Welcome to Wellness Teatime with Dr. Rita, your go-to podcast for all things mental health and well-being. I am Dr. Rita Sonko, and I am passionate about breaking the silence and the stigma surrounding mental health. In support of the Toli Wekka campaign, this podcast aims to increase awareness about the multifaceted nature of mental health and normalize conversations that promote understanding and support. Join me as we explore various topics, share real-life stories, and provide practical advice to help you achieve optimal well-being. Let's embark on this journey together because, remember, Toli Wekka, you're not alone.
All right, so I'm called Dr. Kalani, and I work with the Ministry of Health in the Mental Health Division. So when we were requested, and I was requested to give a keynote address, and thanks Dr. Rita and everyone else for putting this together. I think it's been a success. I thought to myself, what am I going to talk? And so I'm just going to talk about mental health, stress, mental illness, and a few tips that we can take with us on how to stay mentally healthy. Listening to the panel here speak, I think most of what I'm going to say will just be putting bits and pieces of what was shared, putting them together and making sense out of them. So I'll start by the definition. What is mental illness? What is mental health? So WHO defines mental health as a state of well-being in which an individual realizes his or her own abilities or potential, is able to cope with the day-to-day stresses in life, is able to have meaningful relationships, make decisions in life, work productively and fruitfully, and contribute to his or her community. You'll note that that definition is devoid of technical terms such as psychology, the brain, the mind, and so on and so forth. So simple. One, it is a state of well-being. That means mental health is a positive thing. Okay? In which an individual realizes his or her own potential, can cope with the day-to-day stresses of life. Life is generally stressful, as we shall see. Can have meaningful relationships, work productively and fruitfully, and contribute to his or her society. With that simple definition, you know that mental health is what we need on a day-to-day basis. It's what we need when we wake up. It's what we need to handle the difficulties we meet at home and at work. It's what we need in order for us to work productively and fruitfully and show results. It's what we need to take care of our families and contribute to the population. So mental health is what we all have. So everyone has mental health because ultimately we all need to cope with the stresses of life. We need to know what we are able to do in life. We need to work productively and fruitfully, and we need to contribute to our societies. As opposed to the saying that we are all mentally ill, but the degree of mental illness varies. I think we are all mentally healthy, but the degree of mental health varies at some point. So what checks mental health? Every day, as we wake up, it is a struggle in the construct or the concept of stress, common the way we understand it. That we meet challenges in our struggle or in our day-to-day hustles to make ends meet, to meet our goals, to meet the demands around us. We sometimes face challenges. And stress, in simple terms, is defined, not in simple terms, I'll simplify it, it's defined as a combination of physical, mental, and emotional reactions that you experience when the demands on you exceed the personal and social resources that you are able to mobilize to deal with those demands. Many words, but I'll simplify. This is me. Okay. I am a father, I am a son, I am a student, I'm an employee, I have a relative somewhere, I'm also a boss somewhere. I have so many roles around me. And all these roles come with responsibilities and demands. Sometimes the demands put on us can exceed the resources we have to meet the demands. There is an imbalance. So when that happens, we say we are stressed. Is that clear? And by resources, I mean this could be financial resources, this could be emotional resources, this could be physical resources. You're burnt out. The demands put on you physically, you can't handle them anymore. You don't have the physical capacity to meet all those demands that you have. That you're going through a lot and you don't have the emotional resources to deal with anymore. That the demands are put upon you financially and you've been strained and you do not have the ability to meet. So in your struggle to meet this, you say you are stressed. And when that comes, it pushes you away from good mental health and takes you towards poor mental health. So mental health falls on a spectrum. And every day as we work, as we operate, we oscillate on this spectrum. Where there is one side we have excellent mental health, and the other side we have poor mental health. And so as we tend towards poor mental health, the stresses are building up. Stresses are building up. We say we have mental health issues and not mental illness. When you continue to have mental health issues for a long time and you don't cope well to get towards the stage of good mental health, the mental health issues can turn into mental illness if not addressed. Then mental illness can affect you ultimately. Is that clear? Yeah. So, how do we know? And I've talked about that continuum before we go to the definition of mental illness. How do we know that people are moving towards the stage of mental illness? And this is what we see. Remember, we say mental health, and then we brought in stress pushes you to have mental health issues. And if you don't cope to go back to mental wellness, you tend towards mental illness. But how do we know? There are common domains or common aspects that are affected that demonstrate that people are tending towards mental illness. One of them is sleep. Sleep. I've met patients who tell me, doctor, I've not slept for 1 week. And they totally do not have sleep. The second domain that is affected is appetite. Food tastes funny. You lose appetite and completely don't want to eat. Tending towards the ill zone. And the third domain is mood. Normally you're happy, your mood is reactive. Things that make you happy, you're happy. Things that anger you, you're angry a bit. And then small things start to annoy you. And even people in the workplace can't recognize. Nowadays you don't understand. You are moody. Even you notice it, that even things that shouldn't make you angry start to make you angry. Then anger comes in, then you start to get feelings of hopelessness. Lose hope. Then feelings of persistent sadness set in, where nothing makes you happy. Even the things that used to make you happy don't make you happy anymore. And then the mood now gets towards depression. It's permanently depressed for a long time. That is anxiety levels. Anxiety is a very common issue. And many times you take things with strides, you're not worried so much. Then you start to have worries and concerns. And you start to worry that even when I go to bed, I'll not wake up. And there is no reason, no evidence that you'll not wake up when you go to bed. Everything starts to make you, and then you start to panic. All of a sudden, your heart starts to race. What's happening to you? Your hands shake, and you think you're going to die the next minute. Then decrease in performance at your workplace. You go in and you're present, call it presentism. Just go and show up, but no work done. You look at your outputs at the end of the day, they are going down. And then you give up and you just stop attending work, absenteeism. You're isolated from others. Physical activity. You feel tired all the time. And when you slept the whole night, you wake up, it's 8 a.m. and you feel fatigued all the time. Some patient described to me and told me, "Doctor, when I wake up, I feel like someone should cane me and get me out of the bed." It's 8 in the morning. The body is feeling fatigued. And this symptom is very common because the patients people go to hospitals a lot. Say, maybe I have malaria, maybe I have typhoid. If you find doctors that, health workers that maybe are interested in other things, they will do all the tests, give you just medicine to treat malaria or something like that. But even after that, you continue feeling fatigue. You start to wonder what's happening to you. Then alcohol levels. Many people who don't use alcohol can start, or even those that use but at moderate levels, increase. You know, alcohol addiction is a journey. Start from experimental use, occasional use, regular use, and then it comes out of hand. So that journey can increase. Then we end up treating another problem, addiction, which is even harder to treat than the common mental illnesses of depression and anxiety. So you've seen that those are the common domains, and the line is thin to distinguish between stress, mental health issues, and mental illnesses. The common mental illnesses here I'm talking about is anxiety, depression, and alcohol and substance use. These are the commonest mental illnesses that are linked with stress. Now to focus on only those ones, because many times when we talk about a mental illness, we are quick to think of the patient who is hoarding rubbish, the patient who is violent, the patient who is talking to themselves, the patient who is hearing voices that other people cannot hear, or seeing things that other people do not see. But that's the minority of the patient. They make only 1% of the mentally ill patients that we see. And yet, you will see later that mental illness is common. It's estimated that 1 in 5 people, it's close to 25%, 20% of people have some sort of mental illness. And these common ones, anxiety, depression, alcohol, substance use, are the ones that we talk about. And for me, I'm not worried about the schizophrenia or the bipolar, the severe mental illnesses, because those ones have externalizing symptoms. The patient will have it today, tomorrow they will present the patient to the hospital, because it has disruptive symptoms. But these ones that are not talked about, they have what we call internalizing symptoms. I feel sad, so part of the symptom is I want to stay alone. I won't disturb anyone. I'll just go and resign in my sadness and I stay alone in my home. So what are mental illnesses? These are conditions, one, that affect the brain. And because they affect the brain, they interrupt the way we feel, the way we think, the way we communicate, and the way we behave. Mark my words, they are a set of conditions that affect the brain. So it's an illness that affects the brain. Unfortunately, because it affects the brain, the way we see it is that it will affect the way we feel, our feelings about things. It will affect the way we think, our thoughts and interpretation of things, the way we communicate, and the way we behave in society. Just like any other disease, because of the heart, it will affect the way your heart pumps. Because the disease of the heart affects the way the heart pumps. This one affects the brain. Mental illnesses cause disturbances in social relationships and occupational function. People who have mental illnesses usually have disturbances in their day-to-day interactions with others and also their functioning at work. And that is a cardinal symptom that once people have mental illnesses, their capacity to work and function is disrupted. Patients with mental illnesses face significant distress, that they are extremely unhappy with themselves. Can you imagine a patient with depression one time told me, "Doctor, I feel lonely. Yes, I see everyone around me willing to help me, but I do not know why I feel lonely." Can you imagine how distressing that is? I feel sad that I have everything and I fail to enjoy anything. A patient with anxiety one time told me, "Doctor, have you ever gone for an interview of a job you really want? That night when you're preparing for the interview, you know how you feel? Anxious." I told the patient. He told me, "That's how I've been feeling for the whole year, every day." It is very distressing. For severe mental illnesses, these patients hear voices. Can you imagine you hearing people talking about you, discussing you? So now you see he's going to eat food when you're about to eat food. Now you see he's about to do this. You think you can manage. I was seeing a patient one time, I like sharing this story. So he had voices, was dealing with voices of people talking about him. But we had treated him to a point that even the maximum dose had failed to resolve the voices, or taking the voices away. So when I asked him that day, "Do you still hear them?" He said, "Yeah, doctor, I still hear them." For example, when I was coming here, they told me that, "You think that young doctor is going to manage us?" But this is very distressing. The point I want to make is that the people who suffer mental illnesses suffer a lot internally. Psychological pain is worse than physical pain. That's why some of them tend to cope negatively and tend having self-injurious behaviors, cut themselves. And they tell you that once I cut myself, it numbs the pain I have. At least I feel better. And some of them take to alcohol as a way of numbing the psychological pain that they have. Mental illnesses, as I say, is very common, 1 in 5, and the burden goes beyond the individual sufferer, but the family, even the country, the community at large. It is very important again to note that the treatment gap of mental illness is 80%. That means only 20% of people with mental illness get the treatment. Only 20% of people get treatment. The rest of the 80% are people like you and I, trying to meet every day. So this paints the picture of the discussions that were being held here. The common types are anxiety, depression, alcohol and substances, but the other types, schizophrenia, childhood mental illnesses, bipolar affective disorders, post-traumatic, and many others. But if there are any 3 types of mental illnesses I want you to know or take home today: anxiety, depression, alcohol, substance use. Addiction is a mental illness, it's not a behavior. Okay? So there are many causes of mental illnesses. Because of time, I won't delve into that. But there is no single cause of mental illness. It's an interaction of social factors, biological factors, and psychological factors. Environment that raised you, the genetic makeup that you have, and then your interaction with the society. All these things interact together to make a mental illness. So there are very many factors that come into play. And very rarely do we find that one single cause is a cause of a mental illness in an individual. There are so many drivers of mental illnesses, as I've mentioned here: unemployment, poverty, alcohol and substance use, conflicts, family or marital issues, which is called physical and sexual violence, high academic demands in schools, parenting issues, bullying. There's so many, as many as we are here. And I think as time goes on with the socio-economic strain, even the causes of mental illness or drivers of mental illnesses even increase. So with that, and this is my final segment, we can agree that at some point we are all stressed. We have mental health issues in our lives because many times we not exactly meet the demands that are put on us. We shall find ourselves somewhere with a mental health issue. Some of us cope and get back to the other stage of good mental health. Some of us fail to cope and find ourselves tending towards mental illness. So what do we do to stay afloat despite the imbalances that we always face? One of them is to have enough sleep. Try as much as possible in whatever we do to rest. Recommend 6 to 8 hours. Sleep is the one natural antioxidant that it keeps us, it reduces our anxiety levels if you feel rested. Okay, so in whatever we do, take some time to sleep. Exercises are very good. Exercises, other than just keeping us healthy, they also increase our happy hormones. Once happy hormones are produced, they make us happier and reduce our anxiety levels and reduce the potential of being sadness. It's important for us to note that once we are stressed or facing challenges, our brains may subconsciously take to alcohol or substances in order for us to cope. And people who take alcohol and substances during the time that they are stressed, chances of being addicted is even higher. Because the brain's, the other happy hormones are low, and alcohol tends to raise them. So it's very easy to get hooked and associate happiness that is rare during those moments with the alcohol. So the importance is in being aware. The key thing is in knowing that whenever I'm stressed, I should avoid alcohol and substance, because chances of being hooked are extremely high. It's important that we know our limits, we draw targets, realistic targets. Sometimes learn to say no. If you note that the demands put upon you are too much, you can get lost in your struggle to meet all these demands. We live in extended families, we have so many demands put upon us at work and so on and so forth. Let us know our limits and boundaries and say no to that. Building social circles, I think we had all these discussions here, is very important, because someone will pick up an issue. Talking to trusted friends and loved ones, sharing is caring, a problem shared is halved. But sharing goes beyond that, can even be explained scientifically. But once you share, you involve the higher centers of the brain, you appraise the situation. And so your reaction towards the situation, once appraised, is less or better. So it will stress you less. Remember, what stresses you is not what's happening, but your interpretation of the circumstance. So once you appraise it, you may have a different interpretation. The reaction becomes less and you be better. Prayer is good, and meditation. I think we've all had a discussion about prayer. I won't talk so much about that. It's important that we create positive experiences. A happy parent is a good parent. A happy father is a good father. A happy husband is a good husband. So in your struggles to be a good mother, in your struggles to be a good father, in your struggles to be a good parent or wife and so on, create moments that will make you happy, that you naturally raise your happy hormones. Because once you're happy, you'll be a better parent. But if you struggle and all the time you're taking one disappointment, you say, this guy don't understand. Well, it makes you a very grumpy parent and you're bound to have these issues. Practice positive self-talk, which is very important. I think all of us should learn how to talk to ourselves. Sometimes the brain can have a distortion. We call it catastrophic thinking. It picks the worst possible outcome. Yet there are even 10 other better outcomes that could be here. Then you focus on it. So identify all these good positive outcomes. Then challenge the negative thought. When you say, I can't make it, I've done it before, this is possible, and so on and so forth. That positive talk helps you go through a stormy wave. It's important that we manage time. I think many times you fail to manage time. Prioritize, do the 3 things that you must do, meet 1 or 2 of them, and you'll be happier. Let's finally make time to parent. I think a lot of things has been talked about parenting. We are abandoning the roles of parenting to the TV and maids and so on and so forth. That's affecting us in very many ways. So in our struggles to meet the basic needs, we should find a balance to spend some time with the children as well, and we transfer the values that they transfer to us. Otherwise, we are raising a valueless generation that will stress not only the children but also us. Because ultimately, the tables turn. When we grow older, we expect them to take care of us. If we do not take care of them well when they are young, we'll have no one to take care of us when it's our time. So with that, I want to conclude that we all have mental health. Some people have mental illnesses. Stresses can lead to common mental illnesses. We can manage our stresses and prevent mental illnesses. Thank you for listening. Thank you so much.
Thank you for tuning in to Wellness Tea Time with Dr. Rita. I hope today's episode provided you with valuable insights and encouragement on your mental health journey. As we support the Toli Wekka campaign, let's continue to raise awareness and combat stigma by having open, honest conversations about mental health. Remember, you're not alone in this journey. If you found this episode helpful, please share it with others and subscribe for more inspiring and informative content. Until next time, take care and prioritize your mental well-being. Together, we can make a difference.